guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be covering care of the cancer survivor. Guys, if you haven't done so already, please be sure to like and subscribe below. I'm also now on TikTok and Instagram. My handle is the same, Nexus Nursing. Without any further ado, guys, let's get started. First question. The nurse recognizes that the client's symptomology typical of acute cancer survival phase includes 1. Fear and anxiety, 2. Despair and anger, 3. Lethargy and alopecia, or 4. Dyspnea and tachycardia. And the correct answer, guys, is 1. Fear and anxiety. So guys, that cancer survival phase, that starts when that patient is first diagnosed, right? So this is when the patient's going through all of these diagnostic tests and all of these treatments or therapies. So there's lots of fear and anxiety. So let's look at the wrong answer choices. 2. Despair and anger. This is when the patient goes through the stage of grief and loss. What is despair? Despair means there's no hope. So the patient's not even hopeful anymore, okay? They're grieving. Choice 3, lethargy and alopecia. This is during the extended survival stage. So this is after the patient has gone through the treatment and they're going through adverse side effects of the treatment, such as the lethargy or alopecia. And choice 4, dyspnea and tachycardia, that's not really representative of any stage at all. They just put it in there. So for this question, the correct answer is fear and anxiety, because when that patient's just diagnosed, and this is when they're starting to try out these different treatments, they're going to be full of fear and anxiety. Next question. Since being treated for leukemia in her early 20s, a client has experienced bilateral mastectomies and has been diagnosed with osteoporosis and hypothyroidism. This health history best reflects the lifelong impact of 1. Cancer on the client's health and wellness, 2. Cancer treatments on future health status, 3. Specific cancers on the health status of survivors, or 4. Genetic susceptibility on the reoccurrence of cancer. Okay, guys, and the correct answer is 2. Cancer treatments on future health status. So guys, when a patient goes through treatment for cancer, they have increased risk of developing these either other cancers or adverse events from the original treatment. Because think about it, if this patient has cancer, let's say they're getting radiation. Well, yeah, radiation kills the bad cells, but guess what? It kills the good cells too. So that can cause the patient to go have anemia, or it kills the bones and causes the patient to go through osteoporosis, or let's say it was thyroid cancer and they're killing that thyroid, excuse me, but that can cause the patient to now go through hypothyroidism. So that's why 2 is the correct answer. Cancer treatments on future health status, because the treatments that patient's getting for the original cancer, it can cause other cancers or other disorders in the future, okay? Choice 1, choice 3, choice 4. Those choices did not cause a secondary pathology from the original treatment. Does that make sense? 1, cancer on the client's health and wellness. 3, specific cancers on the health status of survivors. And 4, genetic susceptibility on the reoccurrence of cancers. None of those really attack that issue of a second pathology happening from the original treatment. So that's why number 2 is the correct answer. In the geriatric population, the primary reason cancer is diagnosed in its later stage is 1. Healthcare benefit coverage is often inadequate. 2. Symptoms are often masked by the effects of aging. 3. Clients are reluctant to seek help for early symptoms. Or 4. Symptoms are often attributed to the aging process. And the correct answer is 4. Okay, the patients have the symptoms. They may go in and see the physician for it, but what happens is because of their age, we're dealing with a geriatric population, it's often mistaken just as part of the aging process and not a true underlying pathology that's really happening here with the patient. And so I tell you guys all the time, the number one reason why cancer is so deadly is because by the time it's discovered, it's already metastasized, because most cancers can be, it can be cut off from the jump as long as we catch it soon enough, right? But the problem is by the time we normally catch it, it's already metastasized, and that's why it's so deadly. So 1, 2, and 3 are all incorrect. Number 4, that is absolutely correct. These patients are usually misdiagnosed that, the symptoms that they're experiencing, it's mistaken as part of the normal aging process, which is not. Which of the following clients is most likely to experience cancer treatment-related problems in the future? 1, a 73-year-old client with heart problems. 2, an otherwise healthy 6-year-old child. 3, a 25-year-old professional tennis player. Or 4, a 39-year-old with a history of depression. And the correct answer, guys, is 2, an otherwise healthy 6-year-old child. Why? They're still growing. Their bones are still growing. Their organs are still growing. So that places them at increased risk for adverse reactions, or maybe even secondary cancer or pathology down the road. Just the fact that their age, the younger that they are, their body is still growing, and they have more time for there to be more of an impact from the radiation or the cancer treatments. 11 months after being treated for breast cancer, a client reports difficulty sleeping and associated fatigue while denying any other signs or symptoms. The nurse recognizes that the client may be experiencing 1, situational depression, 2, normal remission symptoms, 3, PTSD, or 4, delayed effects of chemotherapeutic drugs. And the correct answer, guys, is 1, situational depression. Guys, fatigue, sleep disturbance, sadness, anxiety, these symptoms we often see in the cancer survivor, and those are all signs and symptoms of depression, situational depression that patient's experiencing. And this is very important, okay? The patient needs to be assessed for this, and they need to be treated, because studies have shown that there is a very close correlation, a close link between depression and that patient not healing, that cancer getting worse instead of getting better. Okay, so we cannot ignore any signs of symptoms of depression, because if that patient has depression, while we are treating that depression, we're also helping to treat that cancer that patient's trying to fight. All right, next question. A client who recently completed treatment for cancer shares with the nurse that she is a little depressed, but I guess I'll be okay. The foremost reason the nurse encourages the client to discuss the situation with her primary healthcare provider is that the nurse realizes that 1, the depression will not improve by itself. 2, the medications can help resolve the depression. 3, depression can decrease the client's chances of recovery. Or 4, the depression is a result of concerns about the cancer reoccurring. And I'm not even going to give you guys a minute, because I just gave you guys the answer on the last question. The answer is 3. Depression can decrease that client's chance of recovery. So we absolutely have to address that depression so we can further move them along with the recovery where it comes to the cancer. The nurse knows that the primary factor affecting a cancer survivor's quality of life is 1, the client's pre-cancer physical and mental health status. 2, the presence of a strong support system. 3, the quality and type of cancer treatment received. Or 4, the type and number of cancer-related risk factors the client possesses. Okay, guys, And the answer is 2, the presence of a strong support system. So guys, the 2 biggest factors in the quality of life for these type of patients are the family stressors and social support. So if the stressors are down and the social support is up, that gives them a better outcome for their quality of life, okay? So we want those stressors to be down and the support to be up. So the correct answer is number 2. A client who is a 7-year breast cancer survivor tells the nurse, "My husband will help me bathe when he gets here." The nurse interprets the statement to mean that the client, 1, is reluctant to have the staff see her chest scars, 2, prefers to protect her modesty and privacy, 3, has a healthy self-image regarding her husband, or 4, is not comfortable with the care she's receiving. And the correct answer is 3. She has a healthy self-image regarding her husband. She has no problem. She says her husband's going to go and help her bathe. And this is wonderful, by the way, guys, because what we tend to see is that the patients, they feel ashamed. They feel self-conscious. They feel like maybe they're not worthy enough. They feel like maybe their husband will not be attracted to them anymore. But this woman, on the other hand, she's okay. She said what? She said her husband's going to help her bathe. So she's not being modest. She's not worried. We're not seeing any signs and symptoms of her feeling inadequate in any sort of way. And this is actually a very good thing. She has a positive self-image. The nurse understands the primary focus of education for a client who has just received a diagnosis of cancer is to 1, introduce self-care measures to support health, 2, discuss the management of treatment-related side effects, 3, reinforce the explanation of the risks of proposed treatments, or 4, formulate long-term lifestyle changes to minimize risk factors. And the correct answer is 3, reinforce the explanation of the risk of proposed treatments. This patient just got the diagnosis of cancer. And remember, I think this was on the first question. We talked about this. Well, I talked about this. When the patient just gets that diagnosis of cancer, they're what? Very anxious, very fearful. So with them just getting that diagnosis, it's not enough that they just hear one time what their options are. No, because they're still processing. So it has to be reinforced to them. These are your options. These are the risks. These are the benefits. This may be what can happen to you if you go with this type of treatment. This may be what can happen to you if you don't go with this type of treatment. You have to reinforce this information because all of this is new and the patient's still trying to process while they're anxious, while they're nervous, while they're scared. So when they just get that diagnosis, number 3, reinforcement of the explanation of the risks and benefits, all that good stuff, that's what you need to focus on, okay? To make sure that they understand, you answer all and any questions that they may have. And that within itself will help to decrease the fear and anxiety that they inevitably will have. Which of the following assessment data best confirms the possibility of cognitive impairment in a client with diagnosis of lung cancer? 1, the client's observed writing questions to ask his oncologist. 2, the client states, "I seem to be a little more forgetful lately." 3, the client's wife states, "I have to remind him of everything." 4, clients overheard asking son, "Where did I put my glasses?" Okay, guys, so the best confirmation of possible cognitive impairment would be 2. The client states, so you're getting this directly from the client, not from the wife, not from the son, not from over here. You're getting it directly from the client. That client saying, "I seem to be a little forgetful lately." What is cognitive? What is cognition? Remember, that's how how a person thinks. That's how they learn, right? So the best way we can get this information is from the client themselves. That client telling you that they seem to be forgetful lately instead of getting from a second or third hand source, okay? That client saying, I seem to be a little more forgetful lately. That's a personal evaluation. That's coming from the client themselves, giving you a personal evaluation. So that's going to be best instead of coming from a second or third party source. All right, next question. Which of the following cancer survivors is at greatest risk for post-treatment symptoms and poor treatment outcomes? 1, an Asian dishwasher. 2, a Hispanic truck driver. 3, a Caucasian factory worker. Or 4, an African American carpenter. Okay, guys. So, those who tend to have the worst outcomes tend to be racial and ethnic minorities and those with poor economic backgrounds, right? And so our correct answer is 1, Asian dishwasher. 1, they're Asian, so they're a minority, they're racial ethnic minority. And 2, dishwasher. A dishwasher really doesn't make that much money. They come more from a low income, right? Let's look at our other choices. We have 2, Hispanic. Yes, Hispanic, that's a minority. But truck driver, truck drivers get paid, okay? They make money. So that's only 1. Then you have choice 3, Caucasian. Well, Caucasian, that's not a minority. Factory worker. Yes, factory worker, that's low income, but that's only 1 versus our Asian dishwasher that has 2 of the risk factors. Then we have choice 4, African American. Okay, that's a minority. Carpenter. A carpenter, that's a skilled worker. That's a vocation. You know, they're not rich, but, you know, they make more money than dishwashers. So that's not really considered low economic background. So our correct answer would have been an Asian dishwasher. 1, because of the minority. 2, because of the lower economic background. When assessing cancer survivors regarding the stressors of cancer, the nurse should first ask the clients, 1, if they feel they're stressed by the cancer. 2, how they believe the cancer has affected their life. 3, what they're doing to cope with the stress of having experienced cancer. Or 4, what assistance they need to successfully manage the stressors of dealing with cancer. And the correct answer is 2, how they believe cancer has affected their life. Look at what the question's asking us, guys. It says, when assessing cancer survivors regarding the stressors of cancer, what we want to know is what is stressing them. That's the question. So 2, how they believe cancer has affected their life. What do they find stressful? Choice 1, 3, and 4 do not answer the question. Choice 1, 3, and 4 are talking about how they cope with stressors, but that's not what we want to know. What we want to know is what are the stressors. So we're going to ask that patient to identify what they are. And that's why number 2 is the correct answer. Okay, guys, we are down to our last question. A 78-year-old woman presents to the emergency department with complaints of shortness of breath. She has a history of radiation therapy for a lung mass 7 years ago. When the client asked the nurse if it could be cancer again, the most therapeutic response would be 1, at your age, shortness of breath could be a result of any number of things. 2, that is a possibility, but it could also be a result of your radiation therapy. 3, what makes you think that? Shortness of breath can have many different causes. 4, I wouldn't jump to that conclusion. Let's just wait to see what your healthcare provider thinks. And the correct answer is 2. That's a possibility, but it could be also a result of your radiation therapy. Yes, it could be a possibility that the cancer came back, but it could also be that radiation that you had to treat that original cancer, right, could have caused the second symptomology, the second pathology that's happening to you, right? We've been talking about this whole video. The original treatment that the patient gets for that original cancer can cause problems down the road. And so that's what you're saying to that client, to that patient in the answer number 2. Now let's look at our other choices, which are not therapeutic. 1, at your age. Stop. That is not therapeutic at all. We are not going to say to a patient at your age. Let's stop. I didn't even need to go any further. That's wrong. 3, what makes you think that? What do I always tell you guys? When you are having therapeutic communication, you never say to a patient, why or what made you? Never. That is not therapeutic. When you say to a patient, why, you're putting them on the defense. When you say to a patient, what made you, you're giving them an excuse to say, oh, the voices in my head made me do it. So you never say why or what made you to a patient. So that's wrong. And then 4, I wouldn't jump to conclusion. First of all, you're saying I. This is not about you. It's about the patient. That's number 1. And number 2, we never give advice. That is not therapeutic. We never give advice to a patient. So the only correct answer that it could have been is choice number 2. All right, guys. I hope you enjoyed this video. I hope you found it very helpful to you. Guys, please let me know in the comments if there was anything that I missed, anything that you'd like to see me cover in the future. Please don't forget, guys, if you want to support this channel, please share my content. I'm really trying to get my channel to grow. Share it with any friends, classmates. Please do not forget, I'm on TikTok. I'm on Instagram now. My handle's the same, Nexus Nursing. And please do not forget to like and subscribe below. Thank you for joining me, and I'll see you on the next video.